This is Dr. Toby Moma, President, Faith and Power Ministries, inviting you to watch our new series on this station. It's going to feature a hospice nurse, Mrs. Beth Westmoreland. She's the hospice director of nursing for Crosslands Hospice and also the administrator. She works out of Delhi, Louisiana. And we want to talk to her about what hospice nursing is all about. Many of you have questions on hospice. You don't want to miss the show. Tune in. We're going to be talking about faith. We're going to be talking about the future. We're going to talk about what the afterlife looks like. Miss Westmoreland trained at some of the best schools in the area in Northeast Louisiana. She got her associate's degree in nursing. She's a mother. She's a grandmother, and she's also a member of the Assembly West Monroe. And she's going to be pouring out her heart into the different dimensions of how the faith of God has shaped her hospice ministry. She's explained to me multiple times that the hospice is not just a vocation, it's actually a ministry. You don't want to miss what she has to say. God bless you. Hi, Dr. Moma here, Toby from Faith and Power Ministries. I'm a family physician in Jackson, and I'm the host of this TV show, Health and Wellness with Dr. Toby. It's an honor to have you on the show. My job here today is to educate you with basic medical information that will benefit you in the future. We think a lot of our population don't understand things that we use in medical terms, the medical terms we use routinely. And part of this show is to give you an understanding. And today, this week, we've been sharing about the past few weeks on hospice. And our host, our guest today is a hospice director of nursing from Crossroads Hospice. And she's also the administrator, Mary Beth Westmoreland. You're welcome on the show, Mary
Thank
Beth.
you.
Real
Thank
honor
you,
to
Dr.
have
Toby.
you with us today. And we're going to be sharing about how she got into hospice nursing. If you haven't watched the last two shows, you shared about her background, her personal background. She's shared about what hospice is all about. And today we're going to talk about what hospice nursing entails. How did she get into it? Now, I looked at your resume a little bit, but I think you spent a couple of years doing ULM and became was it a bachelor's or a BSN or an RN or LPN? Because there's so many different titles out
Yeah,
there.
actually, I became an LPN
Okay.
first, and all the while I had 2 or 3 years already of schooling at ULM for nursing. But I had a family, so the easiest route for me to go was for me to get my LPN. So I got that. I worked as an LPN in the nursing home facilities, yada yada. Then things happened, and my desire was to always be an RN. So I went back to school after
Okay.
being out for many years, and I ended up with my associate's degree,
Awesome.
not my bachelor's, at
Okay.
Hines Community in Jackson.
You came all the way to Jackson?
Yeah, I was in Tallulah. I lived in
Oh,
Tallulah, and I drove to
that's
Jackson.
still an hour.
Yeah.
That's a
But it was a
long
bridge
drive.
program. It was a bridge program for LPNs
Okay.
to become an RN in 1 year.
Wow.
So that's what I did.
That
And
is
it was an
awesome.
awesome
Wow.
school.
That's awesome. Now, tell me, for you to be a hospice nurse, do you need an RN? Do you need an LPN? Do you need a BSN qualification? What are the what does
Right.
the current medical guidelines say about being a hospice nurse?
Yeah. Hospice, really and truly, you can be an RN or LPN, but preferably an RN because there's so many things that require only for an RN to do, admits and stuff like that. If it's you have to be a really good nurse as far as assessments. You have to really be on your toes with your assessments and stuff. You have to know because basically when you're out in the middle of a very rural area and it's just you and the patient, you have to know what you're doing. So it can be an LPN, but an LPN can be used kind of, they can see some routine care patients that are stable, but when a patient starts declining, it's kind of, you really need an RN. But it can be an associate's degree RN or bachelor's, it doesn't matter, or an LPN.
So if you're talking to that young girl who's in high school who wants to be a nurse but she's even thinking of a hospice nurse, what courses should she major on, number one, in high school, and then there's a prereqs and all that? What should she be emphasizing in her sciences and arts and all that?
Right. As far as like the nursing program and hospice, you're just going to go through your basic nursing program. And then once you get out of your nursing school, whether that be LPN or RN, RN can become a hospice and palliative care registered nurse. They can get certified in that. And that's a course that probably takes about 3 months. So I don't think LPNs can get certified. I'm not certain on that. But once you're an RN, though, you can get specialized into palliative care or hospice care, kind of the same thing.
You know, there's a specialty in family medicine for palliative care, which I don't think we have anybody in this area that does it.
Okay.
Yeah, I know we have somebody in Jackson who does palliative care, but I don't think there's anybody in Monroe who's a specialist in
Right.
palliative care. But there is you can do a fellowship, which I think is about a 2 or 3 year fellowship after your family medicine residency to become a palliative care specialist.
Yeah.
So I guess it's almost the same thing like a nurse. You can do that extra
Right.
3 months to become
Yeah.
a palliative care
Right.
nurse.
Because in all reality, Dr. Toby, when I was in nursing school, I don't know if we ever touched on palliative care or hospice.
Right.
Because I think in the medical field, we're also geared on treating and healing everybody.
Right.
They forget that not everybody's supposed to be healed here. So that's kind of and I think that's one problem with the, as far as getting nurses and stuff that would be interested in hospice nurses, because hospice nursing, because a lot of times they think that they can't do it because it's just a doom and gloom kind of a job, and it's really about your perception. I mean, as Christians, we know that we are here temporarily, that this is not our home, and that there's a time to live and a time to die. And if being born is so important, and they're in a hospital setting and that baby's taken care of, how much more important it is on the other side for them to die and go to their heavenly home in peace and without pain.
Right. When did you think of going into hospice nursing? Because you worked at a nursing home. So when did you start contemplating going into the nursing home field?
The nursing home or hospice?
I mean the hospice field. Thanks.
I had a friend of mine that she was a DON, first time ever for a hospice to be in Tallulah, Delhi area, and she was a DON. It was goodness, I can't think of the name of it all of a sudden. Anyway, she opened up this hospice there in Tallulah, and she needed a nurse. And I thought, I'd never have done hospice. I had done home health. I was a brand new RN at the time, so I went for it, and I did it for a year. And I was kind of a green nurse, and I didn't really understand how I can, and I wasn't really strong in my faith either. And it was hard for me to handle the emotional aspect of it, of one of my patients dying, one in particular that really got to me. And I remember going into the facility. I was at the nursing home when the patient died, and I can just remember praying. I just said, God, you've got to help me. If you want me to do this job, you've got to help me, strengthen me. Anyway, long story short, I left the hospice field and went to ICU, and I did that for a period of time. Went to home health for a period of time, and then ended back at this in hospice at this job where I'm at now. But it was just I knew that I was called to do that. That was my calling.
In between, God had called you. God had helped you.
Yeah, yeah, yes.
Wow, that is amazing. Now, tell us. I mean, you've talked a bit about your faith as a hospice nurse. Tell us the role faith plays as a hospice nurse. I mean,
well, the thing about it is, hospice can be it's very consuming spiritually and emotionally and physically. So I believe in order for you to be good at it, you just have to have a strong faith in the Lord. You have to spend time with Him. You have to be poured into so that you can pour out to other people. Otherwise, you will be depleted. So I think the big thing is to always just make sure that you spend time with the Lord, and you've got to feed your spirit, man. And you have to pray, and you have to totally depend on the Lord so that you can go. Because we're ministers.
Right.
We are ambassadors for Christ, and to go and try to help somebody that is in a lot of pain, or maybe spiritually they know that they don't have peace with God. I have to be able to be ready to lead them to the Lord on their
Right.
pretty much their deathbed, and that's happened many times, So faith is huge because these people are going into a either heaven or hell, and that's it. And we have to be prepared and share the gospel with
How,
them.
that's the next question I was going to ask. Are there ethical boundaries in hospice about propagating the gospel? Are you
You
going to
know,
be fired by your,
see, that's so.
you know what I mean?
Yeah, because let me tell you what happened to me, and this is the honest to God truth. When I first started this hospice job, I had a patient from California, and he was a hippie guy. I'll never forget him. Um, when I go there, when you do an admit, you have to talk to them about, okay, these are the services that are provided. And one of them was the chaplain. Well, when I mentioned chaplain, he got really defensive, angry, whatever. I continued to see the guy for weeks and months. Um, I didn't really know my owners at the time very well. And the Lord was dealing with me in my faith, but I wasn't very bold in my faith at that time. I listened to the lie of the enemy, though, and he told me, he said, if you pray with him or if you try to share the gospel, you're going to get fired. And the enemy used that lie, and I believed it. And that man ended up passing, and I'm pretty sure he probably did not know the Lord. That weighed heavy on me. So pretty quickly I went to my bosses, and it was just a lie of the enemy because my owners are very Christian.
Right.
One of them goes all over the world and, does missionary trips and stuff. And he told me, he said, Meredith, we want you to. We want you to share your faith.
Okay.
So from that point forward, I thought, I will never
Okay.
do that again. I will try as long as the Lord allows me opportunities to share my faith and make sure that this person is prepared.
Wow, that's
I will always
awesome.
share my faith and lead them to the Lord if
That's
need be.
awesome. That's amazing. And I'm sure you just do that from a Christian perspective. You're not trying to win them to your church or
Oh
denomination.
no. Mm-mm.
Yeah, so that's fantastic. I didn't know that because there's so many things about church and state, and there's
Yeah.
some places you go to they said don't bring your church or your religion into
Right.
here. So I'm happy to hear that. But I guess it's individual, or is it does Medicare care?
Well, the thing about it is too. Part of our services is a
Is the
chaplain.
chaplain somebody
Yeah,
to support them spiritually?
that's right. And the
Wow.
patient can refuse a chaplain,
Hmm.
but actually in our facility, we're all pretty much strong Christians. All of us pretty much. We pray together. We go out and we're not ashamed, and we'll share our faith with whoever. We don't force it on them. We
Right.
build a relationship with them first and let them trust us and see what we're about. But if the Lord allows, we'll lead them to the Lord. We'll pray with them or whatever.
When do you call the chaplain in? Because you have two chaplains. I'm like, that's a lot.
Yeah.
When do you call them in? Is it after something dreadful happens, or is it at the beginning
It's
of
at the
the?
very beginning. At the very beginning, we have a chaplain that can go. They typically see the patient within 5 days. They'll go and just spend time with the family and the patient, pray, read scriptures, that kind of thing. And typically they'll see them. It kind of depends on if the patient is spiritually sound and they're comfortable, then maybe a couple times a month. If there's some issues spiritually and things are winding down for them, we can always increase that chaplain visit because we want them to get that spiritual, that spiritual care that they need. So
And obviously, this certified chaplains, they have to go through a course. You don't just pick them from the street, right?
no.
What are the qualifications you're looking for? I know there's this American chaplaincy certification, or do they have to be Bible schools
They
trained,
don't
or?
have to be Bible school trained. We had a chaplain one time before who I don't even think he had gone to seminary, but he was, I guess, accredited or
Okay.
however you want to say that by his denomination.
Right.
But the other, we have Carrie Rogers, who is also part of our church. She was, she,
School of Urban
yeah,
Mission
she went to
graduate.
SUM and graduated there. And then we have Paul Lipe, who's Presbyterian Church.
Okay.
He's associated with the Presbyterian Church there
That's
in
awesome.
Delhi. Yeah.
Have you ever at any point felt your job was going contrary to your faith, that you were doing something that your conscience wasn't comfortable with? as a hospice nurse, has there ever been that time you came to that point where you were like, this is, as a Christian, for example, if I'm called to abort a baby, it's against my ethical faith belief, so
Right.
that I will stand up and say, I'm not going to do that. So has hospice ever, in your 10 years, am I correct, 10 years of
Mhm.
hospice, have you ever been faced with a situation where you thought your faith was being compromised on your job?
That's a good question.
You know?
I really, I really don't think so.
Okay.
We have.
So it's a Christian-friendly environment.
Mhm.
That's what I'm discovering.
Right.
Yeah,
Yeah.
it's a Christian-friendly environment to work in.
Yeah, it is. And I think maybe the only time I can even remotely think that I felt compromised in any way would be one time, kind of, you're talking about the euthanasia kind of
Hmm.
thing. It was basically a wife that was ready for their husband to pass on, and she wanted us to give him a large dose of medications, and that wasn't going to happen. And
Really?
yeah, yeah, and so that's probably the only time I would say,
Okay.
yeah.
How about family members abusing the drugs? Have you ever come across that? I mean,
Unfortunately.
now you guys don't leave the medicines with them, but you
Oh yeah.
give it to the patient.
No, we leave it there.
You leave the
We,
bottles.
oh yeah, yeah. I mean, because we're in and out of the home so
Of
much,
course.
so we have to teach the family members on the medications and side effects, proper storage, safety, and all that kind of stuff. Yeah, oh yeah. There's been incidences where unfortunately medicines came up missing. Y'all didn't bring us the medicines. It'd be like 15 or 20, 30 Lortabs or whatever come up missing. Um, Medicines, morphine swapped out, and maybe they'd put water in the bottle versus whatever. Um, oh yeah, that's a big issue now.
How do you handle that?
Well, we try to always we try to avoid it before it even starts. So in other words, we take out very small doses at a time. If you
Okay.
take out 30 tabs or 60 tabs of medication, you are giving somebody a lot of temptation to dabble in the medicine. So if we take out just a handful, 10 or 12, and we count them every time, we have to make sure that they are all there. Um, so we try to just, stop it before it happens, so to
Wow.
speak. Yeah.
Mm. Now, in your profession as a nurse, you said there's a 3-month extra course you can take to become a palliative care nurse. Okay. Spiritually, you said they don't really prepare you medically. So I'm curious if somebody listening to me wants to go into hospice nursing, you told us about staying strong in the word, but do you have anything for spiritual preparation? Like, do you have the books that they can read? Do you have material that they can, because if you said, like you said, you got that person who died and it left a lot of scars on your spirit. So how do they prepare for that? I mean, is there any way you can prepare for that? I mean, you can never really prepare for the death of a person, really.
Right.
It's always going to be a life shock. But I'm just curious, did you have anything as a nurse to prepare you for the hospice nurse you went into? I mean, apart from the Bible, apart from the pastor, apart from the counseling, you know,
Honestly, no. Nothing
really?
from a nursing standpoint.
Wow.
Mm-mm.
Yeah.
No.
Because there's a lot of burnout in medicine. So my thoughts is if nurses are burning out at 10%, hospice nurses may be burning out even more
Yeah.
because they water so much and they need to get watered also,
That's right.
you know.
And I think it just goes back to what I'd already said, that you have to stay in prayer and you have to stay, in worship and in your
Hmm.
church. You have to feed your spirit and you have to feed your soul so that you can go out and minister to other people. You have to stay grounded in the Word,
Wow.
and it's all about perception too. It is. You have to understand that if they die in the Lord, that they are so much better, than we are.
So narcotics are currently a big deal in the society. There's a lot of people who are abusing narcotics. How do we avoid that in the terms of our family? the family members and the providers. I'm talking about the providers right now. How do we avoid providers like nursing staff getting hold of narcotics that are meant for the patient? How do we stay away from that?
Yeah, I mean, with our facility, we can do random drug screens and stuff at a drop of a hat. So we check backgrounds prior to hiring a nurse to see if there is an issue there or a past history. Um, so you have to make sure you're careful with who you're hiring, and then you go out and like I would. If I ever suspected that there was a nurse that was doing that, I would probably go behind the nurse, go to their patient's house, look at the medicines, and also the other thing too is we can always look at the pharmacy record of what that nurse
Wow.
has called in, what they picked up, and okay, compare that to what the patient's actually on, and see, you can kind of, so
Follow that up.
yeah, I mean it's a problem.
I'm
I
sure
mean,
you do urine drug screens
yeah,
on your
oh
staff.
yeah,
Has that ever come up, not in your crossroads, but around in other
oh
hospices,
yes, oh it's a big problem.
with staff taking the
Mhm,
medicine that should be for the patient?
that's right.
Wow.
Yeah,
Because it's about $30 I hear on the street for a tablet of
yeah,
Lortab. So you can imagine that
that's right.
commercial value. So some abuse it themselves, some sell it on
Sell
the
it.
street, which is I think the selling is worse. But
Yeah,
again, I think both are bad. But the
yeah.
selling means you have a criminal element to the whole thing.
Yeah, yeah, that is. I've heard of that so often here recently, with other nurses and stuff that have maybe lost their license or their license
Really?
have been limited. Yeah, it's very sad.
So with this opioid epidemic, you're going to have a lot of scrutiny from the DEA and all that on hospices, right? Because
Right, right.
do you get your medicines from regular pharmacies, or are they like what they call it?
Like the e-scripts or the.
Yeah.
Yeah, actually, right now everything is from our local pharmacy.
Okay.
We don't do anything online or whatever. It's maybe as we grow, that's something to eventually look at just because of the ease of it. It would be simpler, more simpler
Mm,
to just order it online, and then have those all those prescriptions and stuff sent to us
wow.
on the internet, on
Hmm.
our email.
Do you
But
have any idea what the origin of hospice nursing was? I mean, how did it come about? Any ideas? Was it started after the Second World War, or?
yeah, actually, there was a woman by the name of, I think her name was Dam Sounder or Saunders in the UK, and she saw the need of hospice in the homes and thought that patients should have a right if they wanted to die, they should be able to die at their house. So
Was
she
that in the
was,
20th century or the
yeah, that was
19th?
1960s, 50s and
Okay.
60s.
Hmm.
Well, Dr. Kubler-Ross was the American physician
Right.
that I guess, I don't know if she had heard Saunders' deal or what, but Kubler-Ross was the pilot for hospice in America, and she actually went to the Senate Special Committee for the Aging and said, "Look, we need to do something about these patients that are dying. They
Hmm.
shouldn't be just stuck in an institution and whatever. If they want to go home, then they
Wow.
should be able to be taken care of at their house and die with dignity at their house."
And she came up with the 5 stages of dying, which
Hmm.
we all talk about: anger,
That's right.
remorse,
Denial.
bargaining,
Hmm.
denial, and then finally, yeah. So that's a very instructive. Tell us a story, if you don't mind, your greatest challenge as a health nurse. Nothing is greater than a story. Or let's say your greatest faith walk. Let me say you came into this and you had your greatest faith walk as a hospice nurse, where you had to stand on faith,
Yeah.
not just on facts. You really had to dig deep to get that faith to overcome that pessimistic or depressed and
Yeah.
so.
Yeah.
Has that ever happened
Oh
in your
yeah.
10 years of
Oh, you
hospice
kidding
nurse?
me? Yeah, of course. Um, I would probably say there was an incident one time. It was a 17-year-old patient, and he was dying with brain cancer. And the family it was so much dysfunction and strife and a lot of addiction. It was just a mess. And he He did not know the Lord. None of them did. It was just so chaotic. But anyway, I just had to stay prayed up, and I'd go into the house, and he was pretty much bedbound for the most part when we first started seeing him, and he was verbal, but just little by little, I gained his trust, and he we got to talking about the Lord, and he would always say, Miss Meredith, just pray that I be healed, and so as time went on, I prayed for healing, and it didn't happen, and I prayed for healing, and it didn't happen, and it just broke my heart, and so, but anyway, we would read scriptures, and I just continued to do what I knew what the Lord wanted me to do, and at the very end of everything, when I knew that he was getting ready to kind of take that turn for the worst, he wasn't able to verbalize much anymore, but the Lord spoke to me, and he said, make sure that he's ready to die. Make sure he's saved.
At 17.
Yeah, at 17.
Wow.
And so I can just remember him laying there, and I called his name, and I said, look, if you died today, do you know where you would go? And he couldn't verbalize to me, so I was holding his hand, and I said, squeeze my hand if you're unsure. And he squeezed my hand.
Wow.
And I said, okay. I said, do you want to know for certain that if you died right now that you would go to heaven? I said, we can just say a prayer, nothing fancy, whatever, but the Lord can save you right here, right now, if you just believe.
Wow.
And he nodded his head and said that, yeah, he wanted to do that. So he got saved, and right then and there, but that was several months of just, it was so chaotic in that house.
How soon after that did he pass away?
Probably within a week or two, something like
wow.
that. It wasn't very long, but I just,
So
it was,
you made a difference. I believe that you guys are ministers.
we are. I believe that
to
too.
the most critical part of a person's life.
Right.
Because, like Jesus said, it's not the man who starts, it's the man who finishes. It's how well you finish that matters.
Yeah.
So hospice ministry is actually I'm not going to say the most important part,
No.
but you guys are playing an integral part of destiny.
Yeah.
Wow.
It's huge.
Thank
Yeah.
you for letting us know. That's just an amazing story, and thank God for that, and thank God that he's in heaven today, hopefully,
That's right.
because of that story.
Yeah.
We're going to come back next week, and we're going to run the last segment of our talk with Mary Beth Westmoreland. She has poured out her heart. She has shared her experience as a hospice nurse. I'm going to share a few things about hospice nurse from her perspective to those of you who might be interested in going into that career, so that you can be educated and prepared, both from a spiritual point of view and from a medical clinical point of view. You don't want to miss our last show. Looking forward to seeing you. And like she said, if you want to give your life to Jesus, all you got to do is say a prayer and just ask him into your heart. If you need healing, the same prayer is available. Jesus can move through that television screen and touch your body. Whatever he does, it's forever. I'll see you next week. God bless you in Jesus' name.
Amen.
Amen.